Hi, my name is Joe Dimatteo Jr., pharmacist, clinical nutritionist. Just wanted to bring to you guys attention here. If you're not already aware, there was a pretty major study done on vitamin D and fish oil supplements. The headline that the article that I printed and will read here is vitamin D and fish oil supplements mostly disappoint in long-awaited research results. So it's a pretty big study. It was done by the National Heart, Lung, and Blood Institute, which is part of the NIH, National Institutes of Health. So, you see a headline like that and you're doing what we do here, that's a pretty big deal. So right away, of course, I wanted to get into it. It did evaluate 26,000 healthy adults, age 50 and older. No history of cancer or heart disease, okay? 20% of them were African American. We'll get to that end later. But the gist of it is they took either one pill of fish oil or one 2,000 unit vitamin D, and they were evaluated periodically over the next 5 years. And the major endpoints were cancer and kind of a vague thing they're calling CVD or cardiovascular disease endpoints. The issues that I have, particularly when the headline is so bold like that, is how was the study done? Were there any flaws in the doses or in the endpoints, things like that? So I will go over a few of the things here that I found particularly problematic with it. Number one, the omega dose was too low. They did use a quality one, so I will give them that. It was a drug source, so it was of excellent quality. So no complaints there, but they only had them do one pill. So it ended up being, they call it a gram, but if you really get into it, it's actually 840 milligrams of combined EPA and DHA. We recommend, if somebody just walks in cold off the street, 25, 30 healthy, we recommend 2 pills a day, which would be 1,600. So right off the bat, the dose is at least half of our most basic recommendation. If somebody comes in over 50, maybe a little history of cardiovascular issues, maybe some concerns there, the dose would be 3,200. So we're really talking at least a half, if not a quarter, of the proper dose. So that's the starting point issue I have with the omegas themselves. Component number 2 is the vitamin D. They have them take 2,000 units, not a bad dose, but the issue there is we really never recommend vitamin D dosing. We recommend a certain blood level. We recommend that you get between 50 and 70, sometimes up to 80 on your 25 OHD, your vitamin D level. Some people don't need to take vitamin D because they're already at 50. Some people need to take 10,000 units every day for a long period of time because they're at 20. So just giving everybody 2,000 and evaluating that as if you've given vitamin D a fair shake is again, similar to the omegas, just not fair. We've always claimed here, my dad always claimed, vitamin D, you start to get your benefits up over 50. So those at the most basic level are my issues with the dosing. Then something that honestly I find pretty stunning, and this is probably the gist of my issue with it. Point blank, I'll read it right from, not my notes, but right from the article itself. A secondary analysis showed taking fish oil lowered the risk of heart attack by 28%, which is statistically significant, says Dr. Joanne Manson, who is the chief of the Division of Preventive Medicine at this hospital in Boston. So 28% right off the bat, just by adding one pill of the fish oil that, yes, is of quality, but that's only 800, again, half or a quarter of our dose, still lowered it by 28%. And then back to the African-American component, like I mentioned earlier, 77% lower risk when you're just parsing out the African-American population. So that's even right here is a dramatic reduction. So I don't know what they were looking for in this study, to see a bold negative headline and then to see significantly statements like 28% overall for everybody in a 5-year period, and 77% for African Americans. To me, that's a big deal. Digging a little deeper, it sounds kind of crazy, but 5 years is a short time. When you're over 50 and, unfortunately, not knowing it, but you're 5 years within, in that time frame from having a CVD event, you've probably already done a lot of damage. And honestly, one pill of fish oil, no, I would have not thought that somebody moderately or unhealthy at 50 who, unfortunately has this on the horizon for them would have, been, totally mitigated by taking one pill. I don't want to say your book is written at that point, but when you're over 50 and you're talking about a pretty short span of only 5 years, this is not like it's over 50 and then it's a 20-year span. 5 years is pretty short when you're dealing with cardiovascular events and cancer. And then on top of it, you still have a 28% drop. So it's a major problem with that. But I think overall, my dad has always recommended, and Joyce here, we always recommend the basics. Even at the proper dosing of omega and vitamin D, we still always recommend, along with your supplements, that you're eating right, that you're exercising, just the basics. We would never be about take this one pill and it's going to fix any cardiovascular and stroke issues and cancer issues. It's a larger piece. It's a piece to the puzzle, but there's a much larger picture here. And then finally, they only looked at cardiovascular disease and stroke. Big topics, certainly. But, a lot of the benefit we find in vitamin D and omegas, is totally glossed over. Autoimmune, arthritis, bone health, mood, cognition. Even omegas, it's black and white that they lower triglycerides. That's not addressed here at all. Again, in terms of CVD health, triglycerides is not, it's one of the markers. There are many, but it's one of the markers. Black and white, it lowers that. So it also even says right in here, don't throw out your vitamin D and fish oil. There's still a lot of other benefits. There's still the heart attack decrease. So, pretty alarming headline and such a major study, but I think I've kind of gone over the real flaws that I saw in this study. It is far from a perfect study. I encourage you to go take a look at it yourself, and maybe if you're very concerned, dig a little deeper maybe into some of the points that I brought up today. So thank you for listening. Thanks for being here with us, and have a great day.